Better clinical conversations, better patient care. Learn practical skills anytime, anywhere. NaRCAD Skills Lab.
Hello, everyone, and welcome to our new series called Skills Lab. We're going to be talking about how to build high quality detailing aids today so that you can have better clinical conversations with the folks you're meeting with on the front lines. I'm Bevan Amira, the Deputy Director here at NaRCAD, and my fabulous co-pilot is here with me as well.
Hi, everyone. My name is Anna Morgan Barsamian. I'm the Senior Manager of Training and Education here at NaRCAD, and I've been working alongside Bevan for the past 5 years. So really happy to be here and excited to get into this session. The goals of today's session are to, one, understand the importance of dynamic educational materials, including detailing aids. Two, review a sample detailing aid in detail. Three, walk through the steps for developing a compelling detailing aid. And four, explore tools and resources to help you create your own detailing aids. And if you don't know what a detailing aid is yet, that is totally okay. We are going to walk through all of that.
At the end of this skills lab, you will know everything you need to know about why detailing aids are important to your detailing interventions and how to get going on building your own. But don't let this skills lab be the only thing that supports you. We also have a wonderful how-to guide as part of our how-to guide series called Building an Impactful Detailing Aid. Those of you who are watching right now can scan this QR code and it will take you directly to our guide, which walks you through how to build a compelling visual for your detailing visits. And we'll have some more extra materials for you at the end of this session to share on our final slides that will also be able to support you in this process.
So,
All right.
what is a detailing aid? It's a compelling visual that clarifies complex clinical evidence and makes the case for clinician impact. Detailing aids help you customize your visits and meet the unique needs of each clinician that you're working with. Finally, they support the flow of your conversation and they help you stay focused and on track during your detailing sessions. And not only for you as a detailer, but also for the clinician.
So important, especially because you have such limited time with these clinicians. So you really want to be able to have something with you that not only helps the clinician understand what it is you're trying to accomplish, but helps you really stay on target. Some other things about what a great detailing aid will do for you if done right and used properly. So the first thing we have is it'll encourage a robust dialogue between the two of you. When you're coming in to meet with a clinician, again, you're not presenting, you are not lecturing, you are really dialoguing with that clinician. And the detailing aid is going to help you draw that clinician out.
An impactful detailing aid will also serve as that shared focal point for the detailer and the clinician that you can look at together to promote a partnership that's focused on solutions.
Yes, we language, very much a solutions oriented partnership indeed. A good detailing aid is also a tangible resource that clinicians can hang on to after you've left. They can refer back to that resource and they can also hopefully share it with their colleagues.
You never know where a detailing aid will end up, so many people can look at it besides the person that you're detailing. It will also correspond directly with specific behavior change commitments. Ideally, a detailing aid will have clearly labeled key messages or actions for clinicians to take, and we will walk through those in a moment.
You'll also want to be thinking about different learning styles. While some people do well with auditory learning, those of you who are tuning into this skills lab right now are definitely going to be visual learners, right? That's why we need great things like these colorful icons, bolded text, and the learners that you'll be meeting with, those clinicians who need a visual, who need to be able to point to something and ask a question and make connections with graphics and good data. They need to be engaged on that level. And many of us need that. So that's no surprise there.
Finally, an impactful detailing aid will offer options for continued contact for clinicians to ask detailers follow-up questions. For example, the contact information for the detailing program or the detailer themselves should be included on the last page for the clinician or their colleagues to easily find.
And we will walk you through every single bit of this with those visual components so that you understand exactly what we're talking about here. Anna, what kind of content should be included in a detailing aid?
So, AD visits are more impactful when a corresponding detailing aid successfully highlights three things. One, relevant data that illustrates the clinical problem or the gap in care. This can be graphs, statistics, or quotes from patients. Two, action-based key messages that encourage clinician behavior change. Again, we'll dive into key messages in a moment. And three, your detailing aid should include tools, resources, or other supports that help clinicians put change into action. You want these to be relevant to the clinicians that you're detailing, to the clinician that is right in front of you at that moment.
100%. And what does it look like? What is a detailing aid? You saw an image a few slides back of two women holding a document. But here's what it looks like up close, and we're going to dive in even more closely. So don't pinch and zoom your screen or hit Control Plus yet. We will walk you through what this looks like. So the first thing you're going to see, of course, is a cover page. But what should be in that cover page? Well, there should be components that really make the case for action and clearly illustrate what the clinical challenge is. It should include a compelling title, and we'll walk through what makes a title compelling in just a moment. So you can see that here at the top of the detailing aid on the left with the orange circle around it. Reducing stigma, saving lives, how clinicians can help patients who use substances. And that's our test case for this skills lab today. We'll be using this detailing aid, which supports clinicians in making change to support patients who use drugs. Another key piece of a cover page is going to be spelling out the potential for clinician impact. You don't want to just state a problem. You want to state that clinicians are a key part of the solution. So here with the orange circle around it, once again, we have taking action to improve patient outcomes. We'll dive into what goes underneath that in just a moment. Back up at the top here, we've got a little bit of data and evidence. Overdoses in our state. And this is used in a generic language so that trainees we teach can use it to practice speaking to clinicians from any state or any jurisdiction they represent. But you'll see that there's some data underneath that. And we'll talk about that in a minute, as well as why local data is so important. And last but not least, on the cover page, you're going to want to call out the specific population or subpopulation affected. And so you've got a graph here that shares confirmed opioid-related overdose rates by race and ethnicity statewide. The more granular you can get with your data, the better. All right. So next up, Anna's going to talk about what makes a compelling title. You don't want to slap just any title on your detailing aid.
Choose language that illustrates a problem and clearly states that clinicians can improve care for their patients. You want that to be clear right at the beginning, right at the top of your detailing aid. So here's an example of a compelling title that Bevan shared. Reducing Stigma, Saving Lives. How clinicians can help patients who use substances. Right away, you know we're talking about reducing stigma to save lives. And after that colon, it's very clear that this is for clinicians who treat patients who use substances. This is a clear, concise, and compelling title. It's also impactful. How can you be more impactful than saying saving lives, telling a clinician that they can save lives?
I love that, Anna. Yes, it's not saying reducing stigma, improving outcomes. It's very clearly spelling out what you just said. And that's just such a great title. All right, so high quality data and evidence. We're going to dive a little more deeply into some of the content we shared just a few slides ago. You'll want to clearly illustrate what the gap in care is by using accessible graphic images. What do we mean by accessible? We mean that most anyone can look at this document and figure out what's going on with this clinical challenge. So right here, we have a few different components. We've got the graph that shares opioid-related overdose rates. We've got all the way to the right in the orange circle that there were 100,000 plus drug-involved overdose deaths in 2022 nationwide. So we're also sharing a nationwide statistic. And we're sharing on the bottom right what's going on in Massachusetts, which was our test state for this detailing aid. So using that local data whenever available has greater impact. And it has a greater impact because the clinicians you are speaking with care deeply about all of the world, I'm sure. But in particular, when they find out something's happening right there in their own county, in their own community, in their own state, there is more of a connection and a feeling of, I want to work on this, that tends to come when local data is being shared. All right.
So, what are action-based key messages? They are clearly worded statements that explain what you want the clinician to do differently or what the behavior change is that you want them to make. They include practical steps involved for the clinician to implement that key message easily. They also stand out in a detailing aid. You can make the key messages a specific color or add icons next to them so that they're easily identifiable in your detailing aid.
All right. So here are the key messages from this sample detailing aid. We have those action verbs at the beginning. So we have initiate a conversation about substance use with supportive, non-stigmatizing language. We have complete an assessment for opioid use disorder, or OUD, for patients who use opioids, either prescribed or non-prescribed. And number 3 is offer patients harm reduction tools and connect them to harm reduction services. These are 3 very clearly stated key messages. Now, if key message number 1 were to say, it's important not to use stigmatizing language, that's not a key message. You're not asking the clinician to do something. So if you're not sure if your key message is powerful or accurate or going to pack a punch, check out that first word or that first phrase. Initiate a conversation, complete an assessment, and offer tools. That means you've got some powerful key messages. And Anna's going to tell you a little bit more about what a good key message sounds like.
Again, a key message asks a clinician to do something specific. Your detailing aid should clearly illustrate 1, the practical applications, so the real world use of a skill or concept. 2, the benefits that key message has to the patient. And 3, the benefits that key message has to the clinician. We'll show you what this looks like shortly through illustrations in our sample detailing aid.
Now, including the content that Anna just shared is very important just to move that needle, just to get those clinicians thinking about, can I do this? Do I want to do this? And how might I do this? But your key messages should also be worded in such a way and with supportive content that it will prepare detailers such as you to be thinking, how can I engage a clinician who might not be ready to do this? So remember, when you're going in to deliver those key messages and you've got your trusty detailing aid at your side, it's normal for clinicians to be hesitant and not immediately accept all of the key messages. They will very likely express questions, maybe even concerns or doubts in adopting new practices. So you may want to include specific content that will address those common concerns. Some detailing aids include an FAQ sheet, a frequently asked question sheet. Some detailing aids have a myths versus facts sheet to get really deep into a clinical topic and what the buzz seems to be around how to provide the best care. Anna, anything you want to share about that?
I've found that the myths versus facts is very easy for clinicians to grasp, especially me also when I'm looking at something like that visual. On one side you have a myth and it's like, oh, I do think that. And on the other side, it's like, actually, this is the fact. Um,
Mhm.
that's really compelling to put in a detailing aid.
Yes, and we've seen great examples, especially examples that help demystify a topic or destigmatize a topic. For instance, a myth on one side that may say myth, folks who use drugs are making the choice to use every day. Fact, drug use is a chemical dependency and a medical condition, right? So, really just getting into and thinking about why might a clinician push back and how can I be prepared and ahead of the curve with my detailing aid to answer those questions up front. So now we're going to talk a little bit more about supportive materials within your detailing aid. Anna, take it away to share how can we support clinicians in making those changes?
So we're going to talk about key messages in our sample detailing aid and how you can support your key messages with illustrations because you don't want your key messages just to be slapped on the page with no context. So we'll walk through the illustrations that we have created. Let's start by looking at key message 1 and the supporting information that accompanies it. The supporting information illustrates how to make a change. So first, the original key message is restated here at the top of the screen. And then we have scripted questions in the blue word bubbles to provide clinicians with concrete examples of how to begin these types of conversations with their patients. Underneath these blue bubbles, you'll see two lists, one being unsupportive, stigmatizing language on the left, and one being supportive language clinicians should use on the right. The red box on the left indicates a visual no, do not use this. The green around the box on the right means green light or the right words to use. This is very clear. It's like the myth and the fact of what to do and what not to do.
I love that. And anytime you can compare two approaches, it's really helpful as part and parcel of behavior change theory. Which way do I want to go here? And you'll also see with the numbers, the small numbers as we go through this, next to conversation starters, you'll see a tiny 4, subscript 4. And then next to words matter, using non stigmatizing language, you'll see a tiny 5. As you're going through, you will want to have reference numbers that relate back to your back page and show where did I get this good stuff? So that if a clinician says, where did you get this scripting tool? How do I know it works? You can say, let's look at this reference. I got this from X source, and we know that it has been tried and tested. So that's one thing to keep in mind as well. All right, let's look at the next key message and see how backup supportive illustrations can underscore the importance of another key message. So just like with the one Anna just walked you through, again, we're restating the key message. Don't be afraid to repeat things visually in your detailing aid. When someone's learning something new, reading it multiple times helps it hit home. And don't be afraid to label things directly as a key message. We get that question a lot. Is it okay to spell out that I have a key message or a talking point? Yes. You're not going to be hiding what you're there to do. You're there to deliver a message. And in this instance, on this slide, we're looking at key message 2 about completing an assessment for opioid use disorder. Now, let's say I'm delivering this message to Anna, who's a nurse. She might say, how will I do that? And I can say, by using the TAPS tool, which stands for tobacco, alcohol, prescription medication, and other substance use. Now you'll see right here that within this detailing aid screenshot, there's a beautiful phone. I've got my phone here. Everyone's got their phone. We can't live without them, unfortunately. And you know that a clinician has a phone, a tablet, or at the very least, a desktop computer. So when you're showing within a detailing aid a screenshot of how to use something technological, it helps take something from concept, from theory, into concrete practice. If I mention to a random person on the street, have you heard of the TAPS tool? And whether they say yes or no, if I were to take my phone out and say, here's what it looks like, it then becomes something someone can grasp. So, what we also include in this detailing aid is, what does this tool actually do? Anytime you're sharing a tool, a resource, something that a clinician can use, spell out what it does and how it's used. So you'll see 2 sub-bulleted lists here. This tool provides, and then you've got 4 things it provides underneath: a risk level, implications of the score, suggested actions, and additional resources. And then if we poke over to the right to the list of who can use it, you see not only can a healthcare professional use it, but the patient can use it, and it's translated into multiple languages. This means a clinician looking at this detailing aid with you knows, hey, if I don't have time to do this, the patient themselves can do it. Last but not least, we have a couple more pieces. Here we have a QR code. Anytime you can include a QR code in a detailing aid, it works magic. You can tell people till the cows come home that you've got resources, that you've got long links that you can send to them. But if someone can scan an app, a code to go to an app rather, right in front of them, it's easy peasy and it's done. On the right, we have one more fact. Anytime you can add backup evidence to your key messages, it will really help drive the point home about how important it is for that clinician to adopt that key message. And in this case, in the blue bubble on the bottom right, it says screening matters. 42% of adults who needed opioid use disorder treatment did not know that they needed it. So that helps, again, drive home the point, hey, doctor or nurse or pharmacist or whomever you are speaking with, this is really important to help your patients who might not know they have OUD, identify it, and get help. And underneath that, we have a little asterisk statement that says, there are additional tools available. This isn't the only tool. You're being transparent with that statement. So there's a lot here, but it's all really good stuff. And you'll see it's spaced out. There's a ton of information, but it can be seen in individual blocks, and you as the detailer can point to each block. Next up, we have key message 3.
So we've had a visual that shows scripting language. We've had a visual that shows a screening tool. And now we're going to look at an online services locator tool. Again, we restate the original key message at the top of the screen about offering patients harm reduction tools and connecting them to services. On the left side, you'll see a list of examples of harm reduction services. Using bullets makes it easy for the clinicians to read, and if you're going through this detailing aid with a clinician, you don't need to read every single bullet. You can just pull out a few that really you think would resonate with the clinician. Within the list, you'll see key content as bolded text, which helps clinician focus on the key information. Right away, the eye goes right to that bolded text. On the right side, you'll see an example of a website screenshot on a laptop. The screenshot implies that the website's easy to use and also it's visually appealing. So if someone sees this, they might be more likely to go to that website and check it out themselves. It's not as scary when they have a visual of what it looks like.
True.
Again, we see a QR code at the bottom of the screen that is linked to a site which can make it easy for a clinician to access the new tool without having to type in the whole website URL. QR codes are amazing, and we really encourage you to use those.
I love this, Anna, and you are right on that the screenshot on the right makes it accessible and makes it clear in a visually appealing way. How many of us look at text and just get immediately overwhelmed by too much text? But then you see, hey, there's some color here. It's a map. I want to click on that. I want to scan that QR code, and I want to see what's next. Speaking of what's next, here is the last piece within the detailing aid that supports key messages. And in this instance, we're looking at a section called Additional Patient Supports, Safety Plans. Now, you'll notice this is not a key message of its own, but it's content that supports the whole initiative. Every key message would benefit from a clinician also filling out a safety plan in partnership with their patients. Here again, just driving this home, we've got a tablet or a phone, depending on how large it is, with a safety plan on it. We also have some great colorful icons that explain what is in that safety plan. So we're calling out key content versus asking a clinician to squint and zoom and try to figure out what's on that safety plan. You can call out, like Anna said, these bolded pieces of text that really grab the key nuggets. So if I'm detailing Anna and using this part of the detailing aid, I could say, Anna, this is a great example of a safety plan you can use with your patients. And in this gray box, there's a list of the key pieces: emergency contacts, community resources and support groups, a list of coping skills, and which harm reduction options that patient is choosing to try out. You can also check out this safety plan by, surprise, scanning a QR code, which again just makes it that much quicker for someone to try something out. Not only are you showing them that it's quick, a great detailer will pull out their phone and say, let's scan it now. Let me show you how it works, so that that clinician is this much closer to behavior change. So again, think about what other supportive content will really make this detailing campaign and all of its key messages that much more impactful.
And then we move into the final page, and we have contact information at the top of that page of the detailing aid. Including contact information for your program will allow clinicians to easily schedule follow-up visits with you or any of the detailers on your team, ask additional questions that may come up after the visit, and or recruit new clinicians to be detailed. Remember, like we mentioned earlier, your detailing aid or other materials might make their way to clinicians outside of the ones that you're detailing. So maybe it gets left in the lunchroom. Anyone should be able to pick up your detailing aid and quickly know who to contact if they'd like more information. You can share your contact information with a business card or via email as well.
And again, if you're not sure if you'll be the one detailing or who will be contacted, provide a website, provide something, and then also know, as Anna said, you can staple or paperclip a business card at a later date onto that detailing aid. All right. One of the last pieces is resources. So similarly to saying, how can we support this entire initiative? We also want to remember that we as detailers will not have all of the answers to everything. And while we can be a support to clinicians, they can also have questions that you may be able to point them in a better direction for answers. So we want to include in this test case additional resources about opioid safety. You'll see within this, with all the blue hyperlinks, hey, there's a CDC prevention index here. There's more information for healthcare providers in general. There are training links. The fourth link you'll see says training, effective communication in treating substance use disorders. So let's say you're meeting with a clinician who says, gee, I'm really still not comfortable yet having a conversation with my patients about substance use. You can say there's a great training that the CDC provides. Here's the link and you can check it out. And again, you're probably noticing a trend. We've got the QR code going so that if someone's saying, these are a lot of links, can you email them to me? You can say yes, but you can also say everything in this box is accessible with this QR code. So again, you want to think about what other agencies, especially federal groups, can back up what you are sharing as key messages and key information for your campaign. Again, these are resources that will help the clinicians, can also be resources that help the patients. Let's say I'm detailing Anna and she says, this is all well and good, but I don't know what to offer my patients or how my patients are going to pay for this prescription or where they can be referred to treatment. Your resource section is a great place to put things that will answer those commonly asked questions. And then wrapping it all up and bringing it home, like we were talking about before, we've got references.
So including a reference list at the end of the detailing aid that clinicians can refer to for more information is key. Your supporting facts throughout the detailing aid should be cited, and the references should be included here. You can cite those references with superscripts like Bevan mentioned earlier, those tiny numbers next to the words.
All right. So let's take a breather. You just walked through what's a good detailing aid. What does it look like? What kind of content is there? Hopefully you're not too overwhelmed. If you are, you can always put us on pause, take a breath, do a stretch, and don't forget you can rewind this and also use many of our other tools that we'll be sharing with you during this skills lab. Now for the second half of the lab. We're going to be talking about the process of developing a detailing aid step by step. If you're taking notes, that's great. But don't forget that the slide deck is also available. And you can, again, share this recording, replay this recording, share it. And we also, really encourage you to check out our other tools. So step one, let's take a big step back. The first question that you should be asking when you're building a detailing aid is, who am I trying to reach? We know that the answer most of the time with detailing is clinicians, unless you're doing something unique and adapting the model. We're mostly talking about folks who are providing patient care. But let's think about who within that group are we talking to? Are we talking to primary care? Are we talking to emergency room clinicians? Are we speaking to pharmacists? Are we speaking to dentists? Get granular and think about within those groups. Are we in a rural clinic? Are we in a busy, bustling urban clinic? Understand the target audience that you're going to be trying to reach. Once you do that, you'll want to think about, what are my goals? What am I trying to accomplish? Again, get granular. Saying, I want clinicians to do better is not a clear enough goal. Your objectives could be something like, I want all of my clinicians with whom I visit to understand the new guidelines about X, Y, and Z, and to adopt the following best practices. If I'm thinking about improving specific patient outcomes, I'm going to want to think specifically about what those are. Prescribing, screening, providing referrals, whatever the case is, figure out your goals. And hopefully you're doing this in a team. If you're not, you can always reach out to NaRCAD.
The third piece of this step one of understanding your audience and defining your objectives is an early needs assessment. So you want to conduct surveys or informal interviews with clinicians who represent your target population that you'll be detailing. So if that's clinicians in the emergency department, clinicians at a primary care clinic, clinicians in a mobile harm reduction clinic, you'll want to practice and have interviews with them to better understand what they're going through on the day to day. Now, interviews can be done one-to-one, or they can be done in a larger format with 4 to 6 people in a focus group setting. It really depends on what information you want to gather and how many clinicians are available to do a needs assessment with. So you may want to know why you should do this. You want to do this to better understand the environment, the workflow, and the culture of the clinical setting you'll be detailing in. Every clinic is different. Even if you're looking at primary care clinics, every primary care clinic is different. Two, you want to better understand the knowledge gaps related to the campaign's clinical topic that you're working on, whether that's HIV prevention, sexual health, opioid use disorder. You also want to better understand the challenges in caring for patients as it relates to your campaign clinical topic. Again, the challenges are going to be different across clinical topics. Fourth, you want to be able to better understand any implicit bias that may arise as you're having these initial conversations with clinicians. This is huge. You want to be able to identify this before you go out into the field and start detailing. Lastly, you want to do this to better understand the learning preferences for this target population that you'll be detailing. So how do they like to learn? Are they visual learners? Are they auditory learners? You want to be able to understand that through your needs assessment.
If you're overwhelmed at the moment, you've never done a needs assessment before, start small. Ask someone that you know who practices in this space to chat with you. If you don't know someone, start asking around, start building those relationships. Don't worry if you haven't done a very large scale focus group before. Just starting to ask people, hey, what would you think if I came in and spoke with you about opioid use disorder screening, is a start.
Mhm.
Step two, you really want to be doing thorough research and developing your content. Now, at this point, you should have already done baseline research to understand what the clinical challenge is and why an academic detailing intervention is so important. In this step, you'll be collecting evidence-based content for your detailing aid. You'll want to gather the latest research on your topic and from a credible source. So again, make sure you are looking at the right kinds of content. If you are scrolling through X and somebody shares a thought about a clinical topic, that's not good research. But if you're reading something that was published in the New England Journal of Medicine by the CDC, by SAMHSA, you're on the right track. You want to see what the newest guidelines on the topic may be. Have there been updates to guidelines? And if so, when and what has changed? Make sure you're conversational in that topic. You want to look at data relevant to your topic, which includes, again, that local data. Don't forget to look at qualitative data as much as quantitative if you can find it. You want to make sure you're understanding how a specific clinical topic or situation or medical condition is affecting a patient population, not just by looking at numbers or randomized controlled trials, but seeing if you can find spaces where there has been narrative content shared. How is this clinical situation affecting a population and how have they spoken out about it? What are their needs? So dive in, roll your sleeves up.
The second part of step 2 is to develop your key messages. You'll want to create 3 to 5 key messages to include in your detailing aid. They should be succinct, clear, and action-based, just like we reviewed in earlier slides. You'll want to craft your messages in partnership with other stakeholders so you aren't alone here. Include people like funders, clinical experts, public health professionals, or patients. These are all people you want on board as you're crafting your key messages. We have a ton of materials online with example key messages at narcad.org within our program planning hub, as well as a guide for field testing your key messages. We'll share a QR code that will bring you directly to that hub at the end of this skills lab.
All right. So step 3, you've gathered your research, you started building your key messages. Now it's time to get into design. Some people who are watching this right now might think, yikes, I don't know how to design something. Don't worry, we're here to help. And there are plenty of tools for folks who may not have a natural propensity to be artists or design something. The first step is to create a draft and review it for accuracy, clarity, and relevance. We'll tell you where you can create that draft in just a moment. But if you're not sure where to start, open up a Word document and just start typing out what it is you want to say. You can also do it the old-fashioned way and sketch something out on a piece of paper with a pen. Just start getting it down. For your format, and again, we'll speak about this in just a moment and give you some tools and tips. You'll want to use a clean, professional design. What does that mean? Something that is not overwhelmed or packed to the gills with content. Less is more. You'll want to incorporate visuals like charts and graphs and images to make that content engaging, but you don't want so much content that a clinician cannot take any of it in. Remember, your detailing aid doesn't need to have everything you want to say and share about the topic in it. It's just a conversation starter. Think of it like a menu. You also want to make sure that what you're beginning to design is easy to read. Use clear fonts, use bullet points, and space everything out. Don't overcrowd. If you're not sure what's crowded versus uncrowded, there are plenty of great examples on our website. Anna's going to walk you through different design tools. This is where those of you who are nervous can exhale and know that you've got it. We've got you covered.
You might be wondering what tools you can use to design your detailing aids. This is a common concern among detailing programs, so don't worry if you aren't a trained graphic designer. You can utilize platforms such as Microsoft Word, Canva, Pictochart, Adobe InDesign, Microsoft PowerPoint, or Google Slides. There are also many more. And you can use those to create your detailing aids or other educational materials. Many of these are free, and you can find tutorials online or right on the platforms themselves. All the platforms have hundreds, if not thousands of templates that you can use, that you can adapt. It can give you a creative idea. So please do use those. They're super helpful. And remember, we're here at NaRCAD to review and reflect on your work. So feel free to reach out and share your detailing aid drafts or other educational materials with the NaRCAD team at narcad@bmc.org.
We're so excited to look at new content, and we've certainly worked with folks who have just been in the baby step stages. So please don't be shy. All right, so you've gotten your content down. Then you're going to want to review feedback and finalize your detailing aid. What feedback are we talking about? Well, you'll want to conduct a review process. Think of it like a peer review. Have your colleagues or your experts that you have hired or asked to look at the content to review the detailing aid for the content itself, for flow and format, and for readability. They may come back with really important information. Something like, actually, this isn't the right word clinically to use here, or this color green is really hard to look at. Whatever it is they want to share with you, have as many folks as you can take a peek. Then You'll want to conduct a pilot test with a small group of the target clinicians or people who represent that target population and gather their feedback. Again, even if you can only get to one clinician and say, if I were to walk in and share this with you, what would you think? That's something. And again, always feel free to share it with us. Gather all your feedback from your pilot testing, from your colleagues, from your team members. Have everyone take a peek and make your final adjustments. This may take a while. Review takes time. You may need to decide, well, 3 different people shared 3 different approaches, which one might work best.
So
All right.
let's wrap up and talk about our takeaways from today's skill lab. You don't need to be an expert in graphic design to create impactful detailing materials. You can create visually appealing materials by utilizing the platforms we just discussed. Be patient. As Bevan mentioned, it takes time to build detailing materials. This is an ongoing process. Lots of iterations need to happen before you get a final draft. Remember that NaRCAD's here to support you. We love to review materials, so please send them to us to review. We'd be happy to look at them. And finally, check out our program planning hub for additional tools and resources, including detailing aid examples that you can adapt. We'll share the QR code on the next slide.
Here we are. So while you're listening to us, you can feel free to scan this. You can also just go straight to narcad.org and you can go to our drop-down menus and select from our various sub pages, whether it's the program planning hub, our toolkits, and just poke around at what are other people doing. On the left-hand side here, you'll see a very beautiful, color-rich academic detailing aid. It's for older adult falls prevention and management. And boy, what a great subtitle. What primary care clinicians can do to reduce injury and death. Yes, it makes it super clear what the detailer is hoping the clinician will be able to do. Tons of again, just great, bright graphics, icons, good statistics, things that pull your eye toward the content. Great example there, and you can review it in full at the Program Planning Hub, as well as the example on the right, which was created by the San Francisco Department of Public Health. We're good colleagues with them. We've known them for about a decade now, and their content is also excellent. I want to bring up what Anna just mentioned as well, that these documents are living, breathing documents. Here at NaRCAD, sometimes we'll change a statistic because something came out that morning that we reviewed and we thought this is a more impactful statistic. So again, don't feel like you need to create a final product that stays static. It's always going to be something that gets updated as new clinical content is released. Back to Anna to one more time plug a couple things that will be helpful to you.
Remember, we have a how-to guide that will walk through the information we covered today in the Skills Lab in a simple, straightforward guide. There's also a link to a detailing aid template that you can edit within the guide. You can scan the QR code to access this guide or find it on our Program Planning Hub.
And here's the template that Anna was just talking about. If you are really overwhelmed and don't know where to start, you can always use this. We created it just for you. It's very bare bones. It's very basic, but it gets you started thinking about what might I want to populate into my detailing aid. And again, a detailing aid, just as a reminder, shouldn't be longer than about 8 pages, but the average is 4. That's the amount you want to be sharing with a clinician. And what you really want at the end of the day is to have that detailing aid be your best supporting actor to back you up so you can have a great conversation with a clinician where hopefully you'll leave that session and the clinician will be thinking, how can I implement what that detailer just shared with me. I'm excited to get started. So check out our template, the QR code's on the right.
Thank you for joining us today. Please scan the QR code here on the left of the screen to take our 30-second survey. It's 3 questions. It's easy to do right on your phone. We want to know how we did and what topics you're interested in for future skills lab sessions. We'll leave this survey open so that whenever you're watching this, you can still submit answers that we will see and we will be checking often. So thank you very much for joining us today. And please do contact us at NaRCAD on X or at narcad.org.
Thank you so much. Pop us an email. Let us know anything you need at any time. Anna and I are happy to be with you today, and we'll see you at our next NaRCAD Skills Lab. Take care.